Thank you, Mr. Chairman, and I want to say thank you to you and Ranking Member DeSaulnier for your flexibility in continuing this hearing today, starting a little earlier than we'd planned as the schedule's changed. But thank you. I think it's an important hearing. I would also say I look forward to the apologies that will come out from my Democrat colleagues when we find it all worked out that there were no Medicaid benefit cuts. The unfettered fear-mongering that's going on, that people with cancer and everyone else are concerned with unnecessarily. I look forward to that and the conscious effort to try to declare before the American people that $880 billion of cuts, which will cut the entire Medicaid funding, is intended. So we'll see. I look forward to that when, in fact, the President and leadership in Congress have said no Medicaid cuts. I hope that gets out. Ms. Shields, thank you for being here. The Congressional Budget Office estimates that expanding association health plans will result in 400,000 uninsured individuals gaining coverage. What are additional advantages of allowing small businesses to band together to offer coverage through AHPs?
Thank you. Again, there's many benefits to allowing these programs. One, you do pick up additional people who had not been insured. We've had, not to repeat myself, but 15% that were uninsured across the entire nation with NAR, so we're picking them up. Secondly, we have a comprehensive plan that is offering great benefits to our members that they were otherwise unable to get. The cost savings, the deductible that is lower, and we were able to lower the deductibles for our members where they were paying for a family $11,000. We were able to bring that down significantly, anywhere from $4,000 to $6,000, depending on which plan they picked. And these are high-quality plans that were ACA compliant and had all 10 essential pieces in it. They're able to keep their doctors. We were allowing them to choose, these plans allowed them to choose their doctors. We also had where we were allowing pre-existing conditions. So it was everything that we were able to provide. It was as if you were going to work for a large employer, but it was a plan that they were able to do as self-employed, which for us, our job is to offer our members benefits, and this was one of the biggest benefits they were asking for.
Yeah. So the disruption of the Tennessee Realtors AHP ultimately put people on the Unaffordable Care Act again.
Absolutely,
Most,
or uninsured.
Or uninsured, which was basically the same in many cases. You had an insurance policy on the Unaffordable Care Act, but you couldn't use it in so many cases.
Right. We heard terrible stories from members, particularly when we had to tell them that we had to cancel the program. I had a member who unfortunately has passed since that time, who had everything from heart conditions to diabetes and ended up dying from Lou Gehrig's disease. Yeah. So to have to tell somebody like that we finally got you on a plan, and then have to tell him, we're so sorry, but now we have to take it away.
Yeah, the cruelty of the courts and the Biden administration in taking people off a plan that worked for them, which provides insurance coverage when you figure across the nation for 85% potentially of our workforce in small business. Thank you.
Thank you.
Ms. Strauss, use of telehealth drastically increased during the pandemic, and as a result, we saw new and innovative ways of delivering care. What feedback did you receive from workers about increased access to telehealth benefits?
Yeah, the telehealth benefit was actually pretty significant during that time. And then going forward, people got used to it and the access to care through telehealth. And so for us, what we saw in the state of Iowa was more access to behavioral health providers during that time because like Iowa, like many states, have challenges with providers and access to providers, especially in rural communities like Iowa has. And so that telehealth piece actually helps to keep people from running into the doctor for things and incurring a cost, a claims cost to that. A lot of these things can be done at no cost to the employee, depending on plans and how these are set up. So what also happened was it actually encouraged people to actually seek that care because maybe that barrier of getting in to see a provider face-to-face is gone. So telehealth is very significant. We'd love to see that continue forward, especially on the health savings accounts qualified plans.
Right, which saves costs as well and helps healthcare. Thank you.
Absolutely.
I yield back.
The chairman